Chapter 10, Calculation of Parenteral Doses. So we'll just go over some of these key terms here. So an active vial system is a two-section vial divided by a seal holding a pre-measured amount of active ingredient in the lower section and a pre-measured diluent in the upper section. Mixing occurs when the two sections of the vial are combined, either through puncturing the seal or moving the seal through pressure. An ampule is a sealed glass container that holds a single dose of medication, usually for injection. An infusion is slow administration of fluids other than blood into a vein. Intradermal is into or within the dermis of the skin. Intramuscular is into or within the muscle. Intravenous is into or within a vein. Large volume parenteral IV bags are larger than 250 ml and go up to 3 liters. Parenteral administration is outside the gastrointestinal tract, mostly considered to be by injection or infusion. Piggyback is a small volume IV from 50 to 250 ml with added medication administered through an established IV line that is kept patent by a continuous IV solution or by flushing. Subcutaneous is beneath the skin, medications injected into the subcutaneous tissue. Therapeutic range is a dosage or blood concentration range that normally produces desired results. Too much may be toxic and too little may not achieve the desired effect and or not be therapeutic. A vial is a glass or plastic container with metal enclosed rubber seal for injectable medications, and it may contain single or multiple doses. If you're comfortable with this material, you can go ahead and perform the following calculations. If not, you can return after you went through the chapter for some extra practice, and extra practice is always helpful with these. Parenteral medications technically include anything administered outside the gastrointestinal tract, but are usually considered to be those given by injection or infusion. Slow release injectable medications are never given intravenously. Parenteral medications have a quicker onset of action than oral medications. Injectable medications may be given if a person is unable to swallow solid medications, if a quicker effect is needed, and if the person is combative, or if the particular medication would be degraded by stomach acid. All medications administered by injection must be in a sterile liquid form. Once these medications have been injected, the medication cannot be retrieved, so special care is needed to ensure that the medication and its dose are correct before administration. Most parenteral medications are available in ampules or vials and are most often prepared as a liquid, either in an aqueous water or occasionally in an oil base by the drug manufacturer. Some medications, especially those used for cardiac emergencies, are supplied as pre-filled syringes from the manufacturer. Medications that are not stable in the liquid form come in powders and crystals that must be reconstituted before administration. These medications are not stable in liquid form for an extended period of time, so stability must be considered at the time of reconstitution and administration. So 10.1, figure 10.1 shows typical ampule and vial containers. As with oral liquid medication, strengths of parenteral medications are identified as weight of medication in a specific volume of liquid. The weight is usually provided in the metric system, so milligrams, grams, and micrograms, and the volume in milliliters. The apothecary system's units of grains per milliliter can also be used, although this is not as common today as it was previously. International units and mill equivalents are found with injectable medications as well. Some parenteral medications are expressed in percentage or ratio strengths, but these are also usually expressed on the manufacturer's label in weight per volume strengths. Because all parenteral medications must be prepared using sterile technique, sterile needles and syringes must be used. Pharmacy staff commonly use syringes ranging from 1 to 60 ml in size when preparing parenteral medications. TB syringes have a 1 ml capacity and are calibrated in 0.01 milliliter increments. 3 milliliter syringes are calibrated in 0.1 milliliter increments, and 5 milliliter and 10 milliliter syringes are calibrated in 0.2 milliliter increments. 20 milliliter syringes are calibrated in 1 ml increments, and 60 milliliter syringes are calibrated in 2 ml increments. Figure 10.2 is a typical TB syringe. 10.3 is a 3 ml syringe. And then 10.4, we have the 10 and 5. Once the parenteral dose has been calculated, the correct syringe must be chosen based on the amount of medication to be administered or added to the intravenous fluids. If the volume of a medication dose is less than 1 ml, it should be measured with a 1 ml TB syringe, except in the case of insulin U100, which is measured in specially calibrated insulin syringes. Doses less than 1 ml that require rounding are generally rounded to the hundredths place because that is measurable on a TB syringe. A 3 ml syringe is a usual choice for measuring volumes between 1 and 3 ml, which would be rounded to the tenths position if necessary. A 5 ml syringe is used for doses between 3 and 5 ml, and a 10 ml is used for doses between 5 and 10 ml. These doses should also be rounded to the tenths position if necessary. A 20 ml syringe is generally used when measuring medication to be added to a larger bag of IV fluid or for an IV push. Parenteral medications may be prepared for direct administration to a patient or for addition to a piggyback or large volume IV bag. Some medications must be further diluted to be safely administered to a patient. The accuracy of measurement of medications decreases as the syringe size increases. The selection of the correct syringe depends on the volume of medication and the precision needed. The liquid volume in a syringe is measured from the top ring of the plunger, not the raised portion in the middle. So in figure 10.4, the 10 ml syringe is pulled back to the 4.8 ml mark and the 5 ml to the 3.1 ml position. What's this? All right, so then we have this syringe here with 1.7 ml and this one with 2.3. All right, we'll skip past practice problems A. Injectable medications are provided in vials or ampules. Some also are supplied in prefilled syringes. Ampules are sealed glass containers, which may only be used once because there's no way to ensure sterility after they've been opened. The use of a filter needle is required when withdrawing medication from ampules in case any glass shards entered the product when it was opened. Vials have a rubber top and are available in single dose or multi-dose vials. Multi-dose vials contain preservatives, whereas single-dose vials do not. Single-dose vials and ampules are slightly overfilled, but the concentration is as written on the label. Powders for reconstitution may come in either multi-dose or single-dose vials or even in acto vials. Most sterile liquids used for reconstitution are also supplied in vials. Here's an acto vial. When calculating parenteral doses, it is important to know the appropriate volumes for the various routes of administration. The intradermal injection limit is 0.1 ml. Medications given subcutaneously are usually less than 1 ml, but may go as high as 2 ml in some instances. Small volume IM injections are less than 3 ml, and IM injections into larger muscles can be up to 5 ml. If your calculations do not yield an answer within these parameters, there is most likely an error in your calculations. The rules for calculating parenteral doses are the same for those for oral liquid medications. The same formulas are used and the calculations are the same. However, the dose volume is generally not as large. If more than one dosage strength is available with parenteral medications, the strength that requires the smallest volume of medication to be administered is the dosage strength that should be used for the drug order, unless the medication is available in a strength that will provide an easily measurable amount to the exact readings for the markings on the syringe. All right, let's do example 10.1. Okay, example 10.1. We have an order for Tagamet
which is cimetidine, 75 milligrams IM every 6 hours. In stock, we have cimetidine 300 milligrams per 2 ml. And we have an 8 milliliter multi-dose vial. And then we have an order again for 75 milligrams every 6 hours. So they want to know the volume to be given for a single dose. So we're going to take the strength of the medication. Place on one side of a proportion. And then on the other side, we know we're going to need the same units directly across. We're looking for the volume, so that's going to be X. And the doctor has ordered 75 milligrams. So now we will do our crossing. So 300X is equal to 75 times 2. All right. So now we just need to take care of that multiplication. So 75 times 2 is 150. And I'll write my 300X again. Now to get X alone, we have to get rid of that 300. To do that, we have to divide it by each side by 300. So over here, that crosses out. We only have X left. Then on the other side, we need to divide 150 by 300. And that gives us 0.5 ml. Now, since IM doses need to be less than 1 ml, that is within acceptable range. We would use a 1 ml TB syringe. Example 10.2, we have a prescribed order of aminophylline, 125 milligrams IV every 6 hours. And again, there's the order. So when interpreting this label, the strength of the medication can be read as 500 milligrams for 20 ml. So they're getting that from here, 500 milligrams and then 20 ml, or 25 milligrams per ml. These are equivalent fractions. The entire 20 ml ampule contains 500 milligram, but only part of this is needed for each dose. Either strength designation may be used to calculate the dose, but the smaller number keeps the calculations more simple. So then they say after doing it, do it the other way to make sure you get the same answer, and you will. So basically the 500 milligrams in a 20 ml into simplest terms is 25 milligrams per 1 ml. So that's going to be the strength of the medication I'm going to use to do my problem. You can use either one. Just keeps it a little bit simpler when it's smaller numbers. And the doctor has ordered 125 milligrams. We know we're keeping our units directly across. I'm looking for milliliters, so that's going to be my X. So now I'm going to do 25X is equal to 125 times 1, which is 125. We want to take care of that multiplication first. So now we have 25X equals 125. We want to get X alone. So to do that, we have to get rid of this 25. And we need to do that on both sides. So we need to divide both sides by 25. This crosses out, we just have X. And then on this side, we need to do 125 divided by 25. Which is going to give us 5 ml. And if you took out this and replaced it with 500 over 20, you would get the same answer.
Some parenteral doses require rounding to a measurable quantity. Usually if an injectable dose is less than 1 ml, it should be rounded to the nearest hundredth. Once rounded, the dose should generally be within a 10% margin. Some medications require rounding to be within a much lower percentage of variation. This is due to the narrow therapeutic range between effectiveness and toxicity levels. Parenteral medications that are unstable in liquid form for extended periods of time are manufactured in a powder form for reconstitution before use. So this is just also like the oral antibiotics that we have to reconstitute. These are also powders we have to reconstitute for injection. The manufacturer's label states the total quantity of the drug in the container, the volume and type of diluent to use to attain the desired strength, the final strength of the medication after reconstitution, and the stability and storage requirements before and after reconstitution. To reconstitute a medication, follow the instructions on the medication label exactly. Before using, the dry medication must be completely dissolved in the diluent. All right, we already talked about how some injectable powders have the 2 separate chambers, the active vial. With injectable medications, the manufacturer may recommend the use of either sterile water for injection or sterile normal saline. Some drugs may require bacteriostatic water for IM injections or even require specific diluents, such as those with a small amount of anesthetic to prevent discomfort with IM administration. When a special diluent is necessary, this diluent may be packaged separately and supplied with the medication, as with some immunizations. If the solution for reconstitution is not indicated, consult a drug reference. Remember that the final volume of medication in the container will always be greater than the amount of diluent added because of powder volume. Once the appropriate diluent has been identified, the amount of diluent for the desired dose must be verified. Vials of some multi-dose parenteral drugs may be dilute with different volumes of diluent to attain different concentrations for different routes of administration. And we'll see that down here. So it has the different right here milliliters of diluent to add, and that will be the strength. So decide on the amount of diluent to add and prepare this for use. After injecting the diluent, the mixing process for an injectable medication is accomplished by inverting the container slowly, unless otherwise indicated by the manufacturer. Shaking the container may decrease the effectiveness of some medication and may cause the liquid to foam. Foaming will make it difficult to withdraw the correct amount of medication. Here's just a little depiction of that. Note the length of time that the medication is stable and the directions for storage both before and after reconstitution. All right, let's do example 10.3.
Example 10.3, we have a reconstitutable injectable medication. It's an antibiotic. And it asks what's the total dosage found in this container? Well, up here we can see that that is 20 million units. If 75 ml of diluent is added to the container, what is the strength per ml? So if we look here at our sheet, it tells us, or at our label, it tells us if we add 75 ml, we make it 250,000 units per ml, which it has here. If we add 11.5, it's going to be 1 million units per ml. What is the route of administration for this medication? It's IV infusion only. What diluent is needed for reconstitution? And that is consult accompanying prescribing information. And it usually will, sometimes it'll tell you right on the bottle. Does it say it on here? How long is the medication stable in the refrigerator after 7 days? After reconstitution, and that's 7 days. So it says right here. And then if the medication is reconstituted to 250,000 units per ml, how many milliliters are needed for a dose? Okay, so we can just take the strength of the medication, which is 250,000 units over 1 ml. And we need to give the patient 375,000 units. How many ml? So we're going to rewrite it. Doing our cross multiplying and dividing. So 250,000 x is equal to 375,000 times 1, which is just 375,000. I'm just rewriting it to have that kind of more organized. All right, so now I want to get X alone so I can solve it. So to do that, I need to get rid of this 250,000 to just have X left on this side. And then I have to do the same thing on both sides. So I have to divide 375,000 divided by 250,000, which is going to give me 1.5 ml.
Calculations with parenteral medications can be performed with ratio and proportion or ratio and proportion for single step calculations and DA for multi-step calculations. Parenteral medications are supplied in single dose vials, multi-dose vials, ampules, and pre-filled syringes. Reconstitution is necessary when a medication is provided in powder form due to an instability in the liquid form. When medications are prepared for injectable routes, the required dilute may be sterile water for injection, bacteriostatic water for injection, 0.9 sodium chloride, which is normal saline injectable, or a special solution provided with the medication by the manufacturer. And then we have the necessary steps when reconstituting medications. And that is it.